Okay.
Dr. Zhitnitsky, tell me about sealants. Who needs them and who doesn't maybe need them, if they are a available tool at all?
Well, sealant is a very easy procedure. It's a special protective coating that we put on the tooth that fights bacteria and doesn't let teeth get cavities. Some people don't need sealants if they've never had a cavity in their life. Chances are it would be a waste. But a lot of us do have cavities, and they have these really, really deep grooves in our teeth that bacteria gather. And sealants cover those grooves up, and they stay. And what happens is that you don't get cavities. It's a really good, very good preventive measure.
Who should get them? Should people with baby teeth get them, or is it after the baby teeth?
You can have baby teeth, grown-up teeth. If you have a little risk of getting a cavity that'll cost you a lot of money to fix, it would be much easier to have a painless procedure that doesn't require any anesthetics or shots or drilling to protect that tooth from a cavity. It just makes all the sense.
You said people with lots of groove. Describe that. What do you mean by? I mean, my teeth have grooves in it, or what?
Yeah, absolutely. The chewing surfaces of your teeth have little indentations in them. They're like little valleys. And some people's valleys are really shallow, so bacteria doesn't get stuck. And some of those valleys are really deep and prominent, and a lot of stuff gets stuck in there, and that's what happens. Those are more prone to get cavities.
I see.
And they're the ones that need the sealants.
I see. So you mean those grooves are big enough for bacteria or food or whatever it is to get somehow stuck in it, but not big enough for the toothbrush to be able to clean them out? Absolutely right. Okay. And dust to get stuck in it, and then and a sealant will prevent that.
And the sealant is a special little flowable viscous liquid that actually flows into the groove and seals everything, and then we shine a special light on it that gets hard, and that way bacteria doesn't get in anymore.
Wonderful. And
it's like caulking for your bathtub.
Got it. And how long does such a sealant on an average last? I'm sure there's no real answer, but what's a good average?
Well, at least a couple of years. Okay. Maybe longer. Some people have had them for years. Some people need them replaced. But it's really easy to replace. Again, there's no drilling. There is no shots. You just clean the tooth, put the new stuff in, and then shine the light on it. It's a really, really great way to protect yourself from cavities.
Okay. Well, wonderful. Thank you very much. Prevention is what it is all about here, right?
Yes.
Good.